So our research question was, what form of healthcare should the United States adopt?
Our issue came from President Donald Trump's election, where he ran for, he was for the repeal of Obamacare, and in a tweet he said, "Obamacare is a total disaster. Hillary Clinton wants to save it by making it even more expensive. Doesn't work. I will repeal and replace." But what do we replace it with?
So the first form of healthcare I looked at was Switzerland's, and a little bit about Switzerland's healthcare. Everyone has to buy statutory health insurance, or SHI, and you can either buy it through the government, which will cost slightly less, or you can buy it through a private insurance company, which will be more, but buying it through the government, you are still getting all the services that you will need. And all the health cares, whether government or private, they provide much more services than the United States does, and this includes visual and dental services. And you can choose what kind of health care you want instead of having to buy it through your company like the United States has, so you're able to figure out which company has the services that you need. And though there is one limitation, there's an economic fallback to Switzerland's healthcare, and that is that America would have to be taxed in order to have this system, because Switzerland's healthcare guarantees that no one has to spend more than 10% of their income on healthcare. So the New England Journal of Medicine found that Switzerland's healthcare is subsidized by tax in order to achieve their goal of no one spending over 10%. Though there are people whose 10% of their income can't fully pay for their insurance, so Switzerland is taxed in order to help for those people who can't pay. Though the U.S. does have a bigger poverty rate than Switzerland, so there would be many people who couldn't fully afford healthcare, and so we would have to tax in order to help with that. Though taxing, if we were to tax people, everyone would be able to be guaranteed to have healthcare, which could fully cover America and really help everyone out. Switzerland's healthcare is economically beneficial. According to the Kaiser Family Foundation, which is a nonprofit organization focusing on healthcare, found that Switzerland is spending less per capita on healthcare than the United States is, as seen in this chart. The United States in 2008 spent $7,538 on healthcare per capita, whereas Switzerland only spent $4,627. So saving this money per capita could then help save statewide, which then could even help save countrywide thousands of dollars towards healthcare. Forbes magazine also found that how Obamacare works is that employers that have over 50 employees that work 30 plus hours a week, they have to provide them with health care. Though some businesses are not able to afford this, so in result they're having to cut employees and cut their hours. But having people not in the workforce and with working less hours would make our economics go down. So because of this, then our economics are hurting through just these businesses. The Commonwealth Fund found that citizens are spending $6,442 in the United States. That should not say per month, that should say annually, on healthcare, whereas Switzerland is only spending $2,000 to $4,000 annually on their healthcare. So each citizen is saving money per year that they are spending on healthcare, and they're getting more services for their money. Switzerland their services provide doctor visits, specialist services, pharmaceutical devices, and home health care, where U.S. is having to pay out-of-pocket or co-payments for doctor visits, hospital services, and prescription drugs, and that was all found by the Commonwealth Fund as well.
So I looked at Canada's healthcare system, and if we were to adopt it, the United States per capita, people pay $8,745 annually, but Canada, they only spend $4,602 annually, so that would save citizens a total amount of $1.3 trillion. And then found by Valeria Valle, who is a researcher. The price of medicine in Canada is negotiated between the government and then the vendors so that prices are lower than here. And then the overall health of the United States could improve because 47 million more people would have health care, 4.7 million more adults would visit emergency rooms, 56,000 fewer preventable deaths would occur, and 4,500 fewer infant deaths would occur, which was found by the Commonwealth Fund. And then a survey analyzed by Karen Lasser, an associate professor of medicine and public health, found that patients in Canada were more likely to visit a regular doctor, more likely to not have unmet health needs, and more likely to not forego needed medicines than their United States counterparts. But some limitations to this is the Canada Health Act limits universal coverage to only medically necessary services, which does not benefit the elderly since most of what the elderly needs is not covered, and 14.1% of the United States population of approximately 316 million is above the age of 65. And then the wait time, since no cost is holding people back from going to visit doctors, would increase, so 17 million more adults would wait 6 days or more to see a doctor or a nurse. And then since Canada's healthcare system is funded through public taxes, the taxes in the United States would have to increase to cover that.
Okay, so before you go on, so sorry.
You can go.
No, go ahead.
Okay, so in addition to all these ideas and healthcare that we could adopt, we could simply just stay with the current one that we have, which is the Affordable Care Act. And the limitations I put before this to give it some context. And why people want to replace the Affordable Care Act is, one of the main reasons is that employees can't qualify for tax breaks if the insurance that's provided through their job costs more than 9.5% of their own household income. And another reason was Obamacare requires that all American citizens carry some form of health care and taxes those who don't have a form of health care. And private insurance companies have had to cancel many of their plans because a lot of their policies didn't cover the ACA's 10 essential benefits. And the increased coverage raised costs for overall health care, but this was in the short term. The benefits of Obamacare was that, first of all, it's a form of socialized health care that aims to provide affordable health care to all American citizens. And it does this by expanding on things like Medicare and Medicaid to cover a wider range of citizens. For women, preventative care services were required to be covered by insurance at no additional cost. Before this, a lot of women who couldn't afford it simply just chose to go without it so they could afford their families. In 2012, the contraceptive mandate made contraceptives to be provided by insurance at no out-of-pocket costs, such as like Plan B or birth control, and it saved women throughout the U.S. $1.4 billion in 1 year. It also helped insure 16 million people who were previously denied healthcare insurance or couldn't afford it because their rates were raised. And this was because before the ACA, there was something that, like if you already had a pre-existing medical condition like a disability or diabetes, you could be denied healthcare or your prices could be raised. And the ACA actually eliminated this, so it can no longer deny or raise costs based on your pre-existing medical conditions. We're going to fix that.
Okay, so go to your first slide, please. I'm gonna make my comments fast and furious. So, what I think is, I think you guys have a very unique. Yeah. Well, the first data slide. So go back to Switzerland one more. That's good right there. So one thing that all of you could take note of in class, but especially the girls here, is that Hannah has Messialis listed 4 of the 5 times. You can introduce your source like you would an essay, and you could say, according to Professor Messialis or whatever, and you could go with bullets from there. Okay? You could do it that way. You could do a T-chart where Messialis is on one side, Biller is on the other, Or because of all three of you, you might have a very unique opportunity where because you are actually making a direct comparison between Switzerland, Canada, and American healthcare system, you may want to make it so that you, Hannah, speak to Swiss, then you, Haley, come in as Canada, and then she comes in as the Affordable Care Act and says, here's what America looks like by comparison. And then you go to your next point. Again, Swiss, Canada, America, next point. You could almost make it that way where you're kind of juxtapositioning all of your points on one slide or topic, and then you're not looking at Swiss, I forget about it when Canada's presenting. Then Canada's done, and now I go to the Affordable Care Act, and I'm trying to remember how those other things all relate. That makes sense? Now go to your next thing here, and when you go to this one here, first of all, the graph, next slide please, the graph looks like it's cut off. Secondly, it's really hard to interpret all that data because it's kind of small. You want to highlight specifically just Switzerland and extract, okay? But other things too is that throughout the slideshow, some of your data points are falling hollow. Meaning, when you get to a percentage, go up to the Affordable Care Act, please, if you could, Haley. Go to Shayla's first slide, I believe. Employees cannot qualify for tax breaks if their job insurance costs more than 9.5% of their household income. Can you give us an example of what a household income would be, what the 9.5% would then equate to, and what exactly are tax breaks? None of your audience, except for Mrs. Hanson and I, are paying taxes, or if they are paying taxes, it's pretty nominal. How is this hurting businesses? How is this hurting individual pockets? How is it benefiting people? That piece isn't really coming through with your data points you're presenting. Second one, Obamacare requires that all American citizens carry some form of health care, taxes those who can't have it. So if I can't afford health care, I get penalized with my taxes? I didn't know that, and you need to draw out some sort of like monetary income data point, something or other that shows that, okay? So this is for all of you. Those comments I just made are not just for the girls. I guess I should stop this now, sorry. Right?